thank you so much for accepting our invitation to this interview, Minister, which will address the province of Ontario's collaboration with Ontario Health and the College of Nurses of Ontario. My first question, Minister, what was the purpose of the partnership with Ontario Health and the College of Nurses of Ontario? Thank you so much.
Well, absolutely. First of all, thank you for the opportunity for allowing me to come on and share this, I think, a great initiative. We've seen since the start of the COVID-19 pandemic, our hospitals and healthcare providers have worked tirelessly, to protect the health and safety of the patients right across our great province of Ontario. And our government, of course, is continuing to find ways to make the necessary investment in our healthcare system. And we also understand and know the stress that this has put on the frontline healthcare workers, be nurses, doctors, and others that obviously, keep us safe. And at the same time, we have thousands and thousands of individuals that are, of course, trained and that arrive in our countries, new immigrants, new Canadians, have the necessary experiences and the skill set and the knowledge to be able to participate and help us in our needs in our healthcare system in the province of Ontario. So that's why our government is, of course, working with the regulatory body, the College of Nurses, to find ways to accelerate and get these individuals involved in our healthcare system. Of course, it helps them, it helps their families, it helps them fulfill their dreams and in the profession that they were originally trained in, while also helping not just in the province of Ontario with our healthcare system, but it also is a tremendous boost to our economy as well.
Very well, Minister. Of the 1,200 applicants from the College of Nurses of Ontario, how many have already been chosen to participate in the initiatives, Minister?
So we're obviously working with the regulatory body, and there are roughly, as you mentioned, 1,200 that are in the process of being onboarded. So all of that work is currently underway, and I know some of them will be starting their training with the nurses, obviously firsthand in hospitals at the front line, and understanding obviously if there are areas or the expertise that they need to achieve to be fully qualified to be able to work in our healthcare system in the hospitals and others, that training will be provided to them. And I know these individuals are going to go on to make a tremendous, tremendous difference in our healthcare system that we obviously desperately need. We know the stress that has put on the frontline healthcare workers. So this is a much, much needed help and assistant our healthcare needs. And this is, I also want to add, obviously, this is in addition to, roughly 6,700 healthcare professionals that have already come on board since the start of the pandemic. And, billions of dollars that our government has invested in healthcare and education, and obviously other areas to make sure that every single Ontarian is protected. They have the necessary healthcare that they need. At the same time, I mentioned, of course, education. Our students are also very, very important, and teachers and the sports staff, and making sure that they're also protected along, of course, with our small businesses and seniors and so forth.
Thank you so much, Minister. Will all hospitals in the province of Ontario receive internationally trained nurses?
So all of that is being worked out, obviously, by our public health units, and individuals, of course, will be deployed as necessary. And this is really to help fill those gaps. Obviously, there are certain hospitals, there are certain regions that require this help more than others. So, we're going to work with our public health to make sure the resources are placed in hospitals and in areas where it's needed.
Very well, Minister. With the increased in the number of cases and the measure taken by the government of Ontario to combat the highly contagious Omicron. The need to add hospital beds arose. It's 3,100 to be exact. Is it possible to make predictions and say that it will not be necessary to add more hospital beds in the future?
Listen, obviously, I mean, it's hard to say. All of this has been a moving target. Obviously, none of us have anticipated these variants that have obviously crossed over the borders and into our country. And unfortunately, you know, we do have to deal with it. And the government responsible at every level obviously have to introduce initiatives to protect our citizens. And obviously, as you mentioned, you know, Ontario has built unprecedented hospital capacity since the start of the pandemic, you know, including just over $5 billion to add 3,100 beds across our province, obviously for a total of approximately 17,000 medical surgical beds that we have in our province. And of course, you know, through these additional investment, the province now has a total of nearly 2,500 adult, you know, ICU beds and approximately 600 ICU beds that, of course, remain available with the ability to add nearly 500 additional beds if required. So, you know, our ICU capacity right now is just over 500 when it comes to the COVID patients that are occupying the beds. But we obviously feel comfortable that we have enough capacity at this point in time, whether it's you know, the regular surgical beds or the ICU beds.
Okay, in summary, the population can be safe.
Absolutely. And listen, that's always been our first and foremost priority. You know, obviously, we can all understand, you know, sometimes when we have to take strict measures and we have to go into lockdown and we have to shut things down, it's not easy for anybody. And believe me, these decisions are not easy for the government as well. But at the end of the day, we have a responsibility to make sure that we keep everyone safe right across our province. And in order to do that, to make sure that we have the necessary healthcare capacity, should that ever come to need. So we need to, you know, we've taken these measures for obviously the right reason, to protect everyone's health and well-being, and we will continue to do that, obviously, until we're able to put this COVID-19 and these different variants behind us.
Thank you so much for accepting our invitation, Minister. It was a pleasure for me. Thank you so much.
Thank you very much. I appreciate it. All the best.